think we're working the record. Oh, I am not sure how much you folks heard of, we can hear you. Thank you, Maria. Okay. All right, good. And I started the recording, so we're in good shape. So if you look at that upright gray box, you will see a number of tabs. Now, you folks are all on mute, which is why, thank you, Maria, for entering in the chat box that she could hear me. You are muted so that you don't have to worry about background noise. Just makes it a lot easier for everyone. But there is a way for you to communicate with me. Might be a comment, might be a question, and that's through something called a chat box. So the last tab within that control panel has the word chat on it, and next to the word chat is either a plus sign or an arrow, depending on whether you are in a Mac or a PC platform. So click on that symbol, the tab will expand, and you will see a box that says type message here. So that is where you will type in your question or your comment to me. Thank you, Aiden. So I'm glad that you folks found that chat box and that you were able to let me know that you could hear me. I wanted to make sure I got that recording enabled as well. So having said that, you know that I am recording this webinar. You will receive an email tomorrow with instructions on where you can find the recording. You know, you might, and I encourage you to do this, share this with your colleagues, share this with your staff. I cannot emphasize enough how important it is for your staff to watch this webinar. This webinar is a little bit shorter than the other ones. I'm going to be emailing all of you a PDF of the presentation so your staff can have that, but I really, really would like them to take half an hour and watch it as well. It'll make a big difference in your practice. So you really get to sit back and relax because, in fact, you're going to receive the presentation, and in the email you will see where to go on tog.com to access the recording. So what we're going to do tonight is we're going to learn the 10 most common patient objections to custom orthotics. Now, I'm a chiropractor, and I was actually a TOG customer before I ever worked with a company. I had 4 different clinics over 15 years, and so I'm sharing this with you firsthand. I'm sharing this with you almost more practitioner to practitioner, much more so than TOG marketing director to customer. So if you can take the contents of this webinar in that spirit. I'm a gal who's tried a lot of different things, and these are not only answers that I have come up with, but I've also worked with and coached with a lot of very gifted people. And so I can't take credit for all of the answers here. This is an accumulation of many years of many people's wisdom. We're then going to look at a couple of ways to utilize the answers that we're going to learn. And then we're going to talk about here's how you want to see that implemented in your clinic. So let's jump in. We've got 10 of these to go through. So the first objection, patient says, I don't have insurance and I can't afford to pay cash, right? So your price might be $400, $350, $500. And for some folks, if they are, say, an entrepreneur, a small business owner, or they're part of that group where, you know, they're working 2 or 3 part-time jobs and they just don't have benefits, you know, and they can't afford to pay that much money out of their pocket. But, you know, you've done your assessment and they need an orthotic. So a good reply to that is that prefabricated orthotics are an affordable and excellent alternative. Now, one thing that you want to point out is that the prefabricated orthotics that they would get from you, which include our Bio Advanced line, can be semi-customized by you, because these orthotics, these prefabricated orthotics, come with a small bag, what we call a component kit, of self-adhesive pads, so you can semi-customize it for them. That's why they should buy it from you and not from the Costco or sports store or drugstore, Pharmacy, Rexall, whatever, CVS. That's why they should buy it from you. It will cost the same. You know, these go for about $45 to $50 a pair. And you will be competitive with that. The difference is that you will semi-customize it for them. We don't sell the component kit separately, so they can't bring you something that they bought at Costco, and then you can just semi-customize it. Okay, so this is a very good option. Now, prefabricated orthotics are different than custom orthotics, first and foremost because of the quality of the materials. As you know, a TOG orthotic shell, the plastic shell, has a lifetime warranty on it. It's going to last them at least a few years, and at that point they'll probably need it what we call refurbished. So some of the padding might need to be replaced, the top cover probably needs to be replaced. But with a prefabricated orthotic, they, depending on the size of the person, how often they wear it, we want them to wear it every day, and the conditions. So, you know, if they're wearing it in a boot that gets really hot every day, maybe they work at Home Depot, versus someone who's using it and they're on their feet lightly because they work in an office. Right, you could have them last anywhere from 6 to 9 months. So for someone who truly needs the device but can't afford it, we say, you know, we're going to let them know, you know what, we care about your health. We have a financial and clinical option for you. What I have found in my practice is that they will feel better with the prefab, but they'll say, I realize that the prefab is not going to last a long time, and they will save the money. And it might take them 6 months, but in 6 months they'll say, I've got the $500, I want to buy the custom device. Okay? Second objection, I'm in pain and I need something right now. No problem. Let's put you in a pair of prefabricated orthotics while the custom devices are being made. They might say, I can go to the Costco and stand on that plate and get a Dr. Scholl's orthotic for $120. We know the problem with that is it's not going to address all of their problems. People are never symmetrical, and so a custom device is going to address the unique differences from the right to the left foot, as well as anything that might be happening in the forefoot. A prefab can't do that. While at the same time, let's not throw out the baby with the bathwater. If they're in pain today, at least let's get them in a quality prefab that you can semi-customize. Now, it's not throwing away money, because when their custom device finally arrives, they can just use the prefabricated orthotic in a pair of shoes that they wear less often. Objection number 3, and this is a very common objection. They'll say, well, how do I know that the orthotic will help me and not the other therapy we're doing? You know, so let's say someone has plantar fasciitis, pardon me, and they are doing, you know, you've told them they need to ice, and they need to stretch their calves, and they need to wear proper footwear, and maybe you're doing some soft tissue work on it, okay? So they'll say, well, how do I know? Or maybe you're also doing some laser therapy on it, okay? So they'll say to you, well, how do I know what's helping? How do I know that it's not the stretching and the icing that's helping and not the orthotics. In the meantime, I've gone and used up these benefits or I've paid cash. So although this is a common question, in reality, we know that we never know. As a practitioner, you don't know. It's very rare that you do only one thing with the patient. It's very rare that you will say to them, we're going to do some soft tissue manipulation or some joint manipulation, or we're going to use a modality like ultrasound or laser or IFC and nothing else. So we never know. The bottom line is that you want to get better. We also know from research that's been done in the last probably 10 to 15 years that if a patient receives a number of different treatments from different therapists in different clinics, that they will not do as well as those who receive everything all at once from one clinic. And so there's something interesting there. There's number one, that everything is being done at once, and you're not introducing therapies one at a time. So you're not saying, okay, Mrs. Jones, let's try stretching for a week. If stretching doesn't help, let's add ice. If that's not getting better, then let's add some better footwear. Oh, you're still not better? Okay, let's now do some laser, right? If you do all those things at once, we know Mrs. Jones is going to get results and she's going to get them fast. What's interesting, and call it placebo, we can easily call it placebo because we don't know what else to call it, is that if one practitioner has a multifaceted treatment plan for the patient that includes all of those things. In this case, it would include stretching, icing, footwear, laser, soft tissue work, and orthotics. And if they get all of that from one practitioner, research shows that patient does better because you've got one person who is managing the entire treatment plan and they know every facet of it. So they know, okay, time to stop icing and do less stretching, but now you can start to wear dress shoes to your daughter's wedding. Okay, so in other words, I know this is kind of a long answer, but I found that this is a fairly common question, not just around orthotics, but around treatment plans in general. People say, I don't want to do all of that all at once. I don't want to use up all my benefits. It's like, well, not only do I have the experience to tell you that if you do it one thing at a time, you could get to the finish line and not even have the results you want. You're better off doing it all at once. Okay, and that's just not your experience and my experience. We actually have research showing that now. Actually, and now someone's probably going to email me and say, hey, Lori, do you have a research article that you can send me about that? I will take a look. It's done in the research was done out of a physiatry clinic in Edmonton called Gross Rehab. Dr. Gross owns it. That's the name, Gross Rehab. So physiatry, and it's Dr. Gross. So if you wanted to look up some of that research, that's where I would start. A fourth objection. This is a really common one, and I'm sure those of you who are dispensing orthotics have heard this. I've tried orthotics in the past, and they didn't help, right? Here's the patient who walks in with a shopping bag full of orthotics. If you've ever heard James Canning speak, you know what he says about this. So what we're going to say to the patient is, Mrs. Jones, you definitely have an indicator that custom orthotics are required. But I want to see all of these old pairs of orthotics that you have because I want to see how they were made. I suspect that they were either missing a modification or they had too many modifications. Important. I'm going to talk about that in a minute. I'm going to say, Mrs. Jones, I'm going to contact the clinical experts at the orthotic manufacturing lab and ensure that you get a perfect orthotic. Here's the key, you guys. Mrs. Jones, if you are not 100% satisfied, I will refund your money. And at TOG, we back you up. If you and your customer are not 100% satisfied in the first 90 days, we give you 3 months, which is a ton of time. In the first 90 days, you send that orthotic back to us, and we will fully refund you. No problem. So let's go through this answer because it's very important that you and your staff have this answer memorized, okay? We want to memorize this answer. Number 1, we're saying, Mrs. Jones, you definitely have an indicator that custom orthotics are required. Okay, so we're going to say to her, we've checked you. We can see that when you walk, you're overpronate. We can see that when you walk, you have this equinus. Your heel lifts early. We can see that when you walk, your knee buckles in as your arch drops. We can see, Mrs. Jones, that when you walk, your forefoot is slapping down. That means you need orthotics. But I am not going to rush you into this, okay? I'm not going to rush you into this, Mrs. Jones. I want you to bring in that bag of old orthotics because I want to see what has not worked for you. And that's important. The fact that you're not pushing her to make a decision that moment is going to gain her trust because all of a sudden you're actually really concerned about her. You're not just trying to make a sale on the spot. And you really do want to see those old orthotics. And most of the time you'll see that they are either missing an addition or the person added too many. The most common missed modification is extrinsic forefoot posting. Okay, so that is a very, very common. So they've got compensated forefoot varus. And that, if they need that extrinsic forefoot posting and they don't have it, they will never, ever get the results that they want. Okay, so that's a number 1 miss. A number 2 miss is that they have a little bit of equinus, so their heel lifts a little bit early, but the orthotic that they got has no extrinsic posting, so there is 0 lift at all. So for these folks, they need at least a rear foot extrinsic post and maybe even another millimeter or 2 of additional lift. So those are very, very common. If you have a gait scan, that's amazing, right? You can show her, see this red number on that chart, or you see the curves, however you like to use it, maybe the gait line. If you don't have a gait scan, you might want to consider getting one, but you can say, look, what I'm going to do is I'm going to have you bring those orthotics in. You might even use your smartphone and take a photo of those orthotics, email it to our customer service department, and call our clinical team and then say, here are the findings, here are the pictures of Mrs. Jones's old orthotics, what should we do? Okay, and let me tell you, a guy like James Canning is going to know in 2 seconds why Mrs. Jones was never satisfied with those old orthotics. And let me tell you something, if you go through this with Mrs. Jones, she is going to refer all of her friends and family to you, right? You have not only pushed her in, you have not pushed her into making a decision on the spot, which she appreciates, but you actually asked her to bring the bag in. Most practitioners wouldn't. And then you took a photo of them, and then you said to her, look, Mrs. Jones, I'm still not going to rush you into this. I want to consult with the clinical experts at the lab and see what they have to say. And only then will you be able to make your recommendation to her. But that's not enough. even though you're going to do all of that, you are going to offer her a 100% satisfaction guarantee. Okay? So again, please, all of you out there and all of your staff should have this objection, this script, and I hate to use the word script, but you should use your own words, but cover all of those points, right? You have an indicator. I want to see the bag of old orthotics. I suspect this is why they didn't work. I'm going to contact the experts at the lab, and I'm going to give you a 100% satisfaction guarantee. 5 points that you want to have down to memory. Objection number 5. I've tried orthotics before and they made me feel worse. If you've ever had that said to you, you kind of feel like you just fed someone spaghetti and they spit it out on the table. You're just like, oh, gee whiz, what am I going to say to this person, right? Here's the first thing you say, I am so sorry to hear that, right? I'm sorry to hear that. Wow, that's lousy that happened. It's unusual, but it can happen. Especially if, and this is where I'm going to relate back to the same comment, bring in your old orthotics. I suspect they either missed or added too many. If they made the patient feel worse, the previous practitioner probably added too many modifications. Okay? Some practitioners think that if they're going to charge $400 or $500 for an orthotic, they better make it look fancy. So they rear foot extrinsic post, forefoot extrinsic post. They pad that thing up with neuroma pads and submetatarsal accommodations and flanges, and man, that thing will hardly fit in a shoe. It's going to make someone feel worse. So we're going to use the same idea. The difference here is we are going to say, I am really sorry to hear that. Okay? It can happen. Before we go any further, I want to see the same talk track. I want to see your old orthotics. I suspect this might be the problem. I'm going to contact the experts at the lab, and then I am going to offer you a 100% satisfaction guarantee. So you can see talk track is almost exactly the same. Now, what you need to do is put yourself in the patient's shoes and say, well, okay, let's take it one step at a time, doc. On my next appointment, I'll bring in that pair of orthotics that made me feel terrible. And, you can look at them and you're going to take a photo. You're going to consult this other group. So no one's forcing this patient to make a decision on the spot. Well, orthotics don't fit in my shoes, right? And this is the shoe that they wear. And let me tell you, you have probably seen much worse shoes than this, that your patients come in with 5 and 6 inch heels and they want to wear an orthotic in it. Well, yeah, I'd like to go tap dancing in that, but it's not really going to happen. Now, here's the good news. People who wear shoes like this, and don't get me wrong, I love heels. I wear heels about 5 days a week, but I don't wear them all the time. I certainly don't wear them when I'm going to be on my feet all day. When I get home, I don't wear my heels. And so we always have an opportunity to have this person get 2 pairs of orthotics, one that they can wear in a shoe like that. Let's say they're a lawyer or they work in an office environment where they have to be dressed up. They really can't wear a flat shoe. So that's their reality. No problem. We can make an orthotic to fit in that shoe. But we should really look at making them 2 pairs of orthotics, or add a prefabricated pair in addition to the custom orthotics, so that they can get the benefit in a flat shoe, whether that's their home shoe, Maybe it's just they're kicking around out casual, doing errands on the weekend shoe or at the gym. At the orthotic group, in a shoe like this, we would put in what's called the fashion flex. If it was a lower heel, about like an inch or less, and a little bit wider, we could use a dress flex, okay? Dress flex is wider, but if it's got any kind of heel, we definitely need to go for a fashion flex. Not going to give a ton of support or help them correct, but if you put on a shoe like that with no fashion flex and then you put it on with a fashion flex, you realize, wow, that definitely feels better than nothing. So don't toss out the baby with the bathwater. Okay, no problem. I've got an orthotic for that shoe. But the reality is that's not really going to get you all the way. We also need to get you a second pair of orthotics. Okay? Does anyone have a patient whose closet looked like this? I wish my closet looked like that. I have so many shoes, and I will never move the orthotic from shoe to shoe, so why bother? The flip side of that is you've got someone who says, oh, I will move them from shoe to shoe, I promise, right? You will get the odd patient who is the dream patient. They comply with all of your recommendations. They do every stretch, every exercise diligently. They ice when you tell them to ice. They heat when you tell them to heat. They're early for every appointment. They refer in their friends and family, and they move their orthotic from shoe to shoe. As you know, there are not that many dream patients out there. Most of our patients are just ordinary people who get distracted by the busyness of life and forget to move their orthotic. Doesn't make them bad, just makes them human. So what are we going to tell them? Tell them, I completely understand. It's always good if you can lend some, if you can, empathy. So for example, I can say to them, you know, I understand. I also have a bunch of shoes. I've got a few pairs of boots, a couple pairs of sports shoes. There's no way I would move my orthotic from shoe to shoe, right? So I can first show some empathy with them. If you're a guy, and maybe you're really one of those guys who only owns 2 pairs of shoes, then say, oh, my wife is just like that. Or, you know, the other therapist in the clinic, she's just like that. Try to show some empathy for these folks so that you don't feel like you're judging them, okay? So you're going to then be able to say, no problem, we can help you. We'll make a custom orthotic for the type of shoe that you wear most of the time, and then we'll make a second orthotic, custom or prefab, that will fit in styles that you wear less often. So what ends up happening, and this was the norm in my clinic, is they'd say, well, okay, I wear a lady's pump most of the time. They'll say, this is what I wear most of the time. Okay, we'll make a custom orthotic in a fashion flex. Then they'll say, okay, but I have a pair of Uggs that I wear on the weekend. And then I've got my workout shoe. And then I've got a pair of sort of kicking around Converse. No problem. So they might end up buying 3 pairs of prefabs because they know they won't even move their prefab, right? So great. Buy 3 pairs of prefabs and 1 custom. And you know that they will be in an orthotic 90% of the time. To me, that's a win. Sorry, looks like that guy has a bubble over his eye. That's from the image I used from one of our partners. Have you guys ever had this? I have heard that custom orthotics are not really custom. This is more common in the US than it is in Canada, but some people will say that, you know, their neighbors saw something on Marketplace in 2008. Actually, I think that's when 2008 did the story on the Orthotic Group, and people are like, oh, wow, are they really custom? Let me tell you, folks, if you have ever been to our facility, and you see how huge it is, and you get we don't do tours of the lab. We can't because of work safety. There is some big, heavy, serious machinery back there, milling out those positives and grinders and whatnot. But we can show you what we call the catwalk, a look over the plant. You will see there's no doubt TOG orthotics are custom. Now, in order to ensure that your orthotic is truly custom, though, I'll say to the patient, I'm actually going to give you a document that is a proof of manufacturing from the lab. You should be giving this to your patients anyway for their insurance claims, but I think it is just a good habit, even if they're paying cash. And so the proof of manufacturing can be obtained when you log into TOG.com and you click on the order tracking button, and you see your patient's name and POM. You just click that and print it off. Okay, so that is your proof. You are really standing behind saying, you as a clinic are not making that, it's the lab. And so that's our legal responsibility. We are not messing around. We've been in business for 30 years. We're a big international company. We're not going to mess around with that. Number 9. But my pain isn't in my feet. So how can orthotics help me? My pain's in my knee. And you can go back and everyone's got a talk track for this. Maybe you will sing them the kindergarten song that, the hip bone's connected to the knee bone and the knee bone's connected to the foot bone, however you like to explain it. People are pretty smart. And one thing that happens is that a lot of medical doctors, more so, and I don't mean this a slam to the medical profession by any means, they're very busy, amazing people, but they often don't fully explain the mechanism of someone's pain to them. They'll just say, oh, you have arthritis in your knee. Well, how did I get it? What does that mean? How bad is it? What else will it affect in my life? What can I do to prevent it from getting worse? What should I stop doing? What should I be doing to help it? Right? Those are all the other things that the person needs to know. And so when they say the pain isn't in my feet, I've got pain in my kneecap, and you want to give me an orthotic? We're going to say to them, the body has something called a kinetic chain, right? A chain reaction. When you stand and you walk, or when you're weight bearing, that chain goes from the feet all the way up. And if just one part of the chain is not aligned or moving properly, the rest of the chain gets a chink in it, right? A little hitch in it. Again, you might use the tree as the tree is bent so the twig grows, or I probably got that cliche wrong, but you get the idea. So I'm going to explain that. If the inflammation and the pain is in your knee, for example, the underlying cause might actually be the way the foot is hitting the ground. That can cause your knee to move abnormally, which will then stress the tissue. When I say stress, I'm always doing a body language where I'm showing like a stretching or a compressing, and they really get that. They get like, oh, I see. So if my arch is dropping, my knee moves in, and that causes everything on the inside of your knee to stretch, and it's not supposed to. And it can cause the joint to crunch against the bones to crunch against each other. So really show just simple like stretching, pulling apart, and then the sort of knuckles of the two hands coming together, showing how the bones are having to move together and rub against each other. So people get that idea of a chain reaction. You might also use the analogy of a car, right? If your car alignment is incorrect, it's going to wear out your tires. Doesn't mean the problem's with your tires. You have to find the underlying cause. And number 10, this is a good one. If I start wearing custom orthotics, I'll have to wear them for the rest of my life. So I'd say to people, it's kind of like brushing your teeth. You don't want to get addicted to that, or it's like going to exercise. You know, once you start doing it, you might do it for the rest of your life. Yeah, you know what? You might decide that this world of concrete and bad shoes puts constant wear and tear on that kinetic chain. So it might actually be something that they want to do for the rest of their life to help prevent future problems. So we're going to say to them, hey, not necessarily, right? Like you're not trying to sell them a product that they're going to become addicted to. And yes, people will say it. I'm going to become addicted to it, and I'm never going to be able to wear shoes without orthotics again. But what we're going to do is we're going to explain to them that the need to wear orthotics versus the choice to wear them for prevention reasons, but the need to wear orthotics depends on whether there's some structural abnormality. So for example, if you've got arthritis in the knee joint, that's not going away. Your body has to adapt to it with every step. And so you wear the orthotic, it helps you get better. You see the results, but then you stop wearing the orthotic, but the arthritis is still there. And so over time, your pain is just going to come back again. Maybe it's scar tissue. Maybe someone had severe plantar fasciitis and actually developed some scar tissue in there. Unfortunately, that's a structural abnormality. Maybe they've got some arthritis in that first MTP joint. Maybe they've got some degenerative changes in their hips or their lumbar spine. That's going to affect the kinetic chain. With age, we tend to get wear and tear in our bodies. So the older the person is and or the more wear and tear, probably they're going to find that they may not need to wear the orthotics all the time like they do at the beginning. They may only want to wear them for specific activities like running or going for long walks. Okay? The key here is we want to let the patient know orthotics are not addictive, and we're going to help them make informed choices once we get them out of pain. Okay, so now we've gone through the 10 most common objections. So I'm going to give you 2 ideas on how you can implement these talk tracks. Okay, so what you might want to do is, print this off when you get the email and, look at some of these. I call them talk tracks. Some people call them scripts. Some people just call them guidelines. Role play. Ooh, I know a lot of people are getting nervous with role playing, but you have to practice it. You really have to practice it. So you can have fun with it if you've got some more sort of extroverted people in your office and you're having a staff meeting. Maybe for every staff meeting, say, we're going to role play an objection. Have one person on the staff be a patient with the objections, and have one person practice being the staff. Just remember, everyone's going to have their own way of saying these things, and have fun with it, okay? But role play it. If you or a member of your staff are shy, ask them to role play it at home with friends or family. When I used to teach at a college, I used to have my students role play telling the patients that they had a diagnosis, maybe a difficult diagnosis, that they have Parkinson's disease, or they have MS, or they have a herniated disc. These are things we have to practice. believe it or not, they don't come naturally. And so you can have someone who's a very gifted therapist, but gosh, by golly, they cannot overcome these objections. And I get these calls on a regular basis. They'll say, I've got the gait scan, I've put up the posters, I've put up the brochures, I've got the orthotic samples and the footwear samples out. We scan lots of people, but they don't get the orthotics. What are we doing wrong? You've got to practice these talk tracks. That's the missing piece. You have to practice it and practice it and practice it. Okay? So get someone you trust again and have these 10 objections and have them just come at you, have them be different people of different ages, have them be Mrs. Jones, who's a retired 70-year-old, ex-librarian, have them be Mr. Smith, who is a 42-year-old owner of a construction company. Have them come in and be Miss Yarrow, who is a busy lady and doesn't have much time to talk. Have them come in and be Michael, who is a business analyst and extremely analytical and wants lots of answers before he's willing to commit. Okay, put on lots of hats, play with it, have fun, but practice it. Remind the patient that the rate of relapse is more than 80% when an orthotic that is needed is not introduced. This is sort of your final, card, if I may use that term. This is your final card. So if you have practiced these talk tracks and you know them down pat, and you're telling Mrs. Jones, look, I've looked at your bag of orthotics, I took photos of them, I've spoken to the clinical team at the lab, I showed them the photos. We're absolutely 100% committed and convinced that we're going to make you an orthotic that will help you. We're also going to give you 100% guarantee, Mrs. Jones, that this will help you. And Mrs. Jones still says, well, I don't know. Here's the danger. The danger is that Mrs. Jones is not going to get better. And you know what? Not only is that a shame for Mrs. Jones, but that looks badly for your clinic. That's the worst kind of advertising you could ever ask for. So it's in your best interest and Mrs. Jones' best interest for her to get better. So I finally need to pull out my final card and say, you know what, Mrs. Jones? I want you to get better. And the problem is that if we do the other therapies, you will get some relief, but chances are within 3 months, you're going to be right back here where you are today, and we're going to be back to square one. So all of that work that you'll have done will be a waste because you're missing this one final piece, which is an orthotic. And that's where you can talk to her if it's a money thing and talk to her about the prefab instead of the custom and talk about the shoes and all of that. Okay, but that's a reality. If a patient doesn't, and we know that with things like antibiotics, they tell you take the whole bottle. Don't stop when you feel better. If someone doesn't follow through their entire treatment plan, we know within 3 months, 80% chance that they're going to relapse and be back in your office with an acute episode. Okay, so there's no harm in reminding the patient of that. So I want to thank you all for attending this webinar. I hope that you are leaving with at least one fresh idea, or that at least you maybe had a little chuckle. But I think that we all have something to learn from each other. And I welcome your comments and your feedback as always. I want to remind you that you'll be receiving an email with this presentation and instructions on where to find the recording of this. Please share this with your staff and the other team members in your clinics. As always, keep up the good work. A healthy community is a safe community, and that's where I want to live. And in the words of one of my favorite personalities, stay warm, but be cool and take care of the ones you love. Thank you, everyone. Hope to see you online again soon.